Well, I've got to get to the studio. You know, our religion, our faith, has to address the environment, has to address the community, has issues of poverty. What are some of the things you liked about Chicago?
Oh, the Art Institute.
And one of the things I know that you and I share is Chicago.
This is true.
Really distinct goals. Our primary interest was in campaign finance reform, but we were also interested in election law and in civil union.
Have better and cleaner politics in Oregon. Dan, good to have you on Speaking Frankly. You know, that's the thing is, we as human beings live together on this planet Earth.
Right.
We also live together in our societies, in our nations, in our communities. Welcome to Speaking Frankly. Well, summer is here, and we waited a while for it, but along with this beautiful weather, for the most part beautiful, why we have some very important projects and important issues that we need to address. And I have as one of my very great friends here, Will Neuhauser, who is chair of the Yamhill County Democrats. Will, welcome to Speaking Frankly.
Thank you, Frank. Always good to be back.
Well, it's good to have you. I mean, this is a fantastic time, isn't it?
It's a pretty good time.
When I think of our president, and I looked at those first 100 days, and now he is now in his second 100 days. Have you ever known a president who did so much in such a short time?
It's quite a bit. I think it's a real testimony to his management style that he's able to delegate effectively to keep a lot of things going simultaneously and not get bogged down in them along the way. So there's a lot to be done, and I think he recognizes the importance of getting started early on projects and not waiting until the end, as many of our recent presidents have done on things like Israel and Palestine, to address that early on rather than at the tail end of their tenures.
Yes,
and
you know,
healthcare reform needs to be tackled, and it needs to be tackled now. So he's doing it now.
Yes, well, that's the thing that I love about Obama. I mean, he's bright, he's well read, he understands what's going on, and he gets involved right away, and gets others involved.
Yep. Just like his campaign, it's actually a pretty well-oiled machine, it seems like.
That's right. Now, speaking about the issues of our time, one of these, of course, has to do with health care. And there's a beginning of a quieted discussion about health care in the United States. The fact that it's so expensive now for some people, you know, others who simply don't have the means and have to go to emergency rooms because they have no health care insurance. What are some of your thoughts about Obama on the health care issue for the nation?
Well, a couple of things. I mean, I think the experiment we've been running for a long time about trying to have private insurance and hope that would work out well for everybody isn't working out that well. And fundamentally, economically, that doesn't work, because what you want as a customer is in insurance is you want to spread the risk.
Yes.
But the business of being an insurance company is exactly designed to do the opposite. If you want to be successful in business, you are trying to eliminate risk.
Yes.
And so that's why we have things like constantly like not covering pre-existing conditions, which, you know, pretty much all of us are guaranteed to have at some point, and trying to make sure that people that overuse the system, et cetera, are cut out. So, you know, personal examples that I've seen in my years in business have been, you know, small companies are constantly getting hit by barrages of increases, vastly higher than others. And part of it is the actuaries back in the insurance company have said, you know, this kind of company, they're costing us more than we thought. And so they change the rules so that it doesn't cover as much stuff, or they charge you a lot more because they really don't want you anymore. They want some other kind of customer. And so you're in this constant set of churn. One of the conservative talking points has been, oh, it's going to be government-run healthcare. You won't be able to choose your doctor. And We just recently in our family had the experience of having the company proposed, the insurance company proposed such a huge increase that my wife's company had to switch insurance. And as a result of that, I can no longer see my optometrist of 30 years. I've been given the choice to not see him anymore because he isn't part of that plan. And my kid's pediatrician isn't covered in that plan. So we have to go find a new doctor. So the existing system is very expensive. It's not covering a tremendous number of people. Almost 50 million people in a year are not covered. One of the highest causes of bankruptcy in America is people whose medical bills have sucked up everything they have, every bit of savings in their houses and everything, and left them destitute, basically. Then they can switch on to Medicare. So we have a system that is not working well at all today, except for a few people. And that pressure has been building for decades now to do something, and it feels like the time is ripe to do it. The challenge is going to be the opposition, which has been pouring incredible sums of money and effort into trying to block any kind of effective legislation that would reform things and keep prices down.
You see, my father came over here from Sweden. Well, all the Scandinavian countries now have state-run health care. And so all the citizens have health care. It's part of being a citizen in Sweden, in Norway, in Finland. You see, what's the matter with us? Why don't we take care of our citizens as a national policy, not simply to make money for big insurance companies?
Well, I agree with you on that, and I think my experience as an entrepreneur and venture capitalist would say it would actually be tremendously beneficial economically if everybody was covered, and therefore they didn't feel hostage to having to work somewhere in order to get insurance. In particular, have to stay somewhere, because if they left, a pre-existing condition would no longer be covered, and then they would be spending tens of thousands or hundreds of thousands of dollars that they may not have to try and meet healthcare needs. Recent studies showed that about 20 to 25% of all employees are in their current job because they're afraid of losing healthcare if they were to leave it. And
Yes.
so that would help level the playing field between employers and employees in terms of getting the right mix. Employees would be more free to go to something more appropriate for them, and employers would not have to deal with people who may be hanging on for the insurance rather than because that's really what they want to be doing for work.
Well, and when you tell me the story about your optician there, I just had a cataract removed here 2 weeks ago.
That's right, yeah.
And I'm so pleased, you see, that there was no question about my being able to have the doctor I wanted to do the surgery and take care of me. It would have been terrible if, as a matter of fact, that because of my insurance plan, I couldn't have had my doctor, who's always worked with me, to be my physician. See, well, healthcare has to be one of the major issues that we address under President Obama. And it has to be good healthcare for all the people. Not just the rich and the affluent.
Yep.
So, now,
what's important to recognize in terms of what we were talking about, that there are also important cost savings to be made and reallocation of where our tax dollars go. Because we're currently subsidizing the health care for rich people because they're getting it through their business, and they may be getting a better plan than the other employees. They may be getting the same one. But that is all tax deductible for the corporation that's paying that insurance. So today, it made sense in the post-World War II era. It may have made sense to use that as a mechanism to get more health care to people, was to encourage businesses to do it by giving them a tax break on that. But now today, in a much more widespread market of people's labor,
yes,
in which people don't work at a company most of their lives. They end up being moved around multiple times. Then you need portable health care to go along with that, not one that's so much tied to a company. And in terms of equity, why should we subsidize somebody who's making $1 million a year's health care when we don't subsidize it at all for somebody who makes $24,000